The purpose of setting up Boronia was for injections was primarily because a lot of people find it very difficult to continue with injections, partly because of the hassles involved in getting carers to bring them in and out, but also because of the cost. If you're having injections regularly for the rest of your life, potentially mount up and become very difficult for people. So what we've done here at Boronia is made it so that there's no out-of-pocket cost associated with the injections themselves. They do not pay for the injection out of pocket. They don't pay for their OCT scan or any consultations. They only pay the prescription fee, which is a PBS fee. It's still a retinal specialist looking after you, but essentially the whole system's streamlined. It means that if you come here then for injections, then you're probably in and out within 30 to 40 minutes, having had all the tests you need and us looking at the results before giving you the injection. The additional benefits are that it's got easy access for disabled people. It's got a free car park, and there's even a cafe outside, so you or your carer can stop for a coffee before, during or afterwards. We also have already had a number of referrals from the Eye and Ear Hospital, from Monash Hospital, and from the Australian College of Optometry. As you know, the public system is stretched. It's very difficult for patients necessarily to get all of the treatment that might be optimal. So I see Boronia's injection clinic as being an extension of the public system, so that people who otherwise would need to be in the public system can be seen here quickly, efficiently. They can be seen and treated in a way that is much more efficient and takes the load off the public system. The injection clinic applies to all reasons for patients having injections, whether it's macular degeneration, diabetic eye disease, retinal vein occlusion, or other conditions that benefit from them. So if you or a friend or relative of yours wants to come to Boronia for injections, that's a very easy thing to do. You simply contact the clinic and they'll walk you through the process. I'm very happy to see you here and continue treatment as required. You'll need a referral, which could be either from your GP or an optometrist or another ophthalmologist. A number of eye doctors elsewhere have referred patients here as well. So when patients are referred for ongoing injection treatment, there is no out-of-pocket associated with that. They only pay the PBS prescription fee. Boronia was initially set up as an injection service, but it's expanded to be a consultation clinic as well. Outside of patients having ongoing injections, this is a private clinic and we have normal private fees with out-of-pocket costs. If a patient's referred initially for a condition that turns out to require injections, then the initial consultation is a normal private out-of-pocket consultation, but subsequent injections are as with all other patients. So if patients are referred for other retinal conditions, vitreoretinal or even medical retinal conditions that don't require injections, such as epiretinal membrane, macular hole, posterior vitreous detachment, then they're seen in a normal private consulting environment. There's an out-of-pocket cost associated with that. The injections are just treated differently.